What's going on, everyone? In today's video, I'm going to show you a technique for releasing your low back. This would be similar to a manipulation or an adjustment that chiropractors or physical therapists like me would use in the clinic. So if you've got tightness in your low back or pain, stay tuned for today's video. Alright, so to perform this technique on yourself, which we would call a side-lying manipulation or adjustment, you're going to be on the ground or on an elevated surface like a bed or a couch if it's firm enough. So what you're going to do is lie on one side. We're going to do both sides, so just start, doesn't matter really which one you start with. To perform this technique, you're going to lie on your side. I'm going to have you straighten the leg that's on the bottom, and then the leg on top we're going to bring up so that my hip goes into flexion to about 90 degrees. From here, I'm going to take my bottom arm, push down on that knee towards the table. This already is going to create some rotation in my low back. From here, what I want to do is reach up with my top arm, and I'm going to rotate my spine and reach back. Now, as I rotate and reach back, I'm also got to make sure to push down with this arm. So I'm creating two opposing rotations at the same time, which is going to stretch my back, and in a lot of cases will cause it to pop and release. So just rotate as far as you can. If it doesn't pop, that's okay. Just even stretching can be really helpful. So just hang out here for a few seconds, let it stretch, and then you're gonna come back up. You can always do that a couple of times if that stretch felt pretty good. If it pops the first time, then usually you just do it one time. Okay, so then come back up. I'm gonna rotate to the other side, so you're gonna see the back side here. We want to make sure to get both sides. So again, straighten the bottom leg, bring the top hip up into flexion. I'm going to push down on that knee with the bottom arm, reach up with my top arm. You can let your head rest down, and then again at the same time push down on my knee while I rotate back to create those two opposing rotations. And usually it gets kind of hard to breathe and talk when you really stretch the spine like this. And again, look to see, sometimes it'll pop right here somewhere in your thoracic spine or your lumbar spine and will really help kind of release tension and pain. Again, if it doesn't pop, that's okay. Just hang out for a few seconds. You can come back. I like to do this a few times on each side just to really stretch my back, improve mobility, and reduce tightness. Okay, so give that technique a try. Again, it's very similar to how we would set people up in the clinic when somebody comes in with back pain and I'm thinking maybe a manipulation or an adjustment would be helpful. This is a very similar technique. I'll move their legs just like that, twist their arm, twist their spine, and then again, obviously I'll be putting some force down on them, so this is a little bit different, but a lot of times doing this on yourself can accomplish similar results. So give it a try. If you have any questions, put them down in the comment section, and I will see you in the next video. Bye.